We'll move on now to Dr. Schneiderman. Thank you so much for being here tonight. Dr. Schneiderman is with the Northern Illinois University Center for Governmental Studies and is going to lead us through the needs assessment results. So we're excited to have her here. And we will be recording this portion of the meeting.
Well, thank you very much for inviting me to present the findings of the Dundee Township Mental Health Board Community Needs Assessment. I enjoyed working on this study immensely. Mark and the rest of the Mental Health Board were great to work with, and I'm here to tell you what we found out. So let me just give you some background. Let's make sure. Nope, wrong way. I'm not good with technology, sorry. Okay, so I'll give you some background. The purpose of the study was to determine mental health, substance use, and intellectual or developmental disability needs, gaps in services, and barriers to accessing services in the township. The study consisted of several different research methods or parts. We did focus groups and an online survey of community leaders and service providers. We did a survey of residents, an inventory of the available services that are currently available in the township, as well as the surrounding area. We did interviews with members of the Dundee Township Mental Health Board, and lastly, we did a demographic analysis of the township. Okay. So I have to go through the methodology so you can see where these results are coming from. I'll go through it quickly because I know you want to hear the findings. So the focus group online survey with the community leaders and service providers, we conducted 2 focus groups right here in this room, one with service providers, so actual providers of mental health, substance use, and ID and DD services, and one with community leaders that included fire, police, school districts, etc. The online survey was for those that couldn't attend one of the focus groups. We sent that to them. We sent them an email with a link to the survey, and we had several people completed online. So in total, we spoke to 19 people. 7 were service providers and 12 were community leaders. We asked them about the greatest needs of residents, the demographic group most in need. So is it teens? Is it adults? Is it seniors? Is it low-income individuals, et cetera? The gaps in service, what they thought were the gaps in services, the barriers to accessing service, and system issues. And that included things like staffing, funding, policy issues, and those were issues that they thought needed to be addressed. Okay. The survey of the residents, the questionnaire, so we selected a random sample of households. I'll explain that in a minute. But the questionnaire basically was developed with the Mental Health Board, and it included questions about mental health services, so everyone was asked their perceptions of how easy it was to get services, different types of services in the township. So mental health services, it was screening and assessment, treatment, and then community support services, the same for substance use and IDD services. But then, so there was a set of questions asking about whether that themselves or an individual in their household actually has one of the disorders or disabilities. So do they have a mental health disorder, a substance use disorder, or an IDD? And we not only asked whether someone in the household has it, but how many people in the household. We asked the characteristics of that individual or those individuals, their age, their gender, what kind, do they have health insurance? We asked the series of questions: are they currently getting services, etc. We also asked about availability of services. This was asked of everyone, just a perception of what types of services they thought were available and not available. Perceptions of the biggest mental health, substance use, and IDD needs by age group, awareness of Dundee Township mental, and then lastly, the awareness of the Dundee Township Mental Health Board. The survey was translated into Spanish, so there was an English version and a Spanish version. The random sample was 2,000 households. They were randomly selected by a firm. called the Marketing Systems Group, which is located in Philadelphia, actually outside of Philadelphia in Pennsylvania. They're a survey sampling firm. They provided names, mailing addresses, email addresses, and telephone numbers to us. We did what's called a multi-mode survey. So we started with the online version. An email was sent to the households, inviting them to participate with a link to the survey. They were sent up to 7 reminders. If they didn't respond right away, they got another reminder, then another. And after those reminders, a hard copy survey was sent to households if they didn't respond to the online version. And lastly, we did telephone reminder calls. The survey ran from November to January. We wound up with 500 completed surveys, and the findings are generalizable to the population. So since we selected a random sample, we were able to what's called weight the data, so that we looked at the demographics of the respondents, we looked at the demographics of the Dundee Township population, compared the two, and did an adjustment so that the people that responded to the survey look like the demographics of your total population. And so that way you can generalize to your population, which is one of the beauties of this methodology that we use. Okay. Interviews with with the mental health board members we conducted over the telephone and via Zoom. They were about 30 minutes in length. And we kind of wanted to get a sense of what do they expect from this community needs assessment. So we have, going in, have a good idea of what we need to what information we needed and how, what we needed to get. And then we wanted to find out what they thought were the strengths and weaknesses of the mental health, substance use, and IDDD services in the township, the greatest needs, the demographic group most in need, gaps in services, barriers to accessing, and suggestions for improvement. Okay. This was a big study, so there's a lot to explain. I'm sorry. The inventory of services. So we did an inventory to see what services existed in the township, as well as we did a 15-mile radius from the boundary of the township in all directions. We used the internet, the National Alliance on Mental Illness, NAMI database, the Substance Abuse and Mental Health Services Administration, the SAMHSA database, the Illinois Department of Human Services, IDHS, Kane County Behavioral Health Council, Kane County Health Department, and then lastly, we did calls to organizations. What was the outcome was an Excel file listing all the different types of services that are available, and an interactive map, which is on the website of the Mental Health Board. You could go up there, you click the map, and you can see where all the services are. There's little dots with the names next to each of the services. You click the dot, and it's interactive, so you will see the name of the service provider, the address, the telephone number, the hours of operation, their website address, the services they provide, the insurance accepted, and which populations they serve, so children, teens, adults, etc. It's really cool. You should go up there and look at it. I'm kind of proud of it. It was the first one we've actually done with all that information in it, so was really excited about that. And lastly was the demographic analysis. The data came primarily from the U.S. Census Bureau, the Bureau of Labor Statistics, the U.S. Economic Administration, and other public data sources. The reason we did a demographic analysis of the township is kind of to give some perspective, about who lives in this township. Population, age, gender, race, ethnicity, language spoken, income. I mean, the ones that are most interesting to me, at least, are the percent below the federal poverty level, and the percent who lack health insurance, but also ethnicity. So you have a large Hispanic Latino population in the township, and that's something that you've got to consider when you're providing mental health, substance use, and IDDD services. You have certain pockets where the federal poverty level is slightly high. Carpentersville is one of them, East Dundee also. And you have pockets where you have the percentage that do not have health insurance is fairly high. Carpentersville and that little section of Elgin that's part of the township. So those are all things that you should keep in mind as important. Okay, so we get to the results finally. Okay, so one of the main findings, and the report is like huge. It's over 100 pages long. It's on the website, the Mental Health Board's website, if you want to read the whole thing. This is just a summary. I'm not going to cover everything, but these are, I think, the key findings. One of them is residents' awareness of the Mental Health Board. And the Mental Health Board is fairly new, so you wouldn't expect high awareness at this point, but this is something that you can track, that we can track if we do the study again to see if the needle is being moved. So with more communication to the residents, et cetera, are they moving the needle? So almost 2/3 of the survey respondents have never heard of the Dundee Township Mental Health Board. That's the red part of the graph. And then 20.6% have heard the name but know nothing about it. That's the pink part of the chart, the graph. Know a great deal is, you can't even see the little green sliver over there. That's 0.5. Know a moderate amount is the light blue, 1.8, and the dark blue is, they know a little, 11.7. The other thing is the findings from when we spoke to the Mental Health Board members, they were very aware that awareness was low among residents. They said they probably don't know anything about us. So that's an area of, that can be worked on and improved. Residents' awareness of existing services. Service providers and board members believe that residents do not know where to go to get services, and we proved that in the survey. Across all survey respondents who thought it would be hard to get information or services of any type, do not know where to go or who to see, or do not know where to look for information, were consistently among the top choices. 1/2, 49.3% of survey respondents think that not knowing where to go to get services is the main barrier to accessing services. And when we ask what's the main barrier to accessing services, it's people don't know where to go for services. And 1/5, 21.0% of survey respondents specifically identified better communication of resources as a service support or resource that should be added to the community. So we asked them, well, what do you want in the way of services or resources, et cetera? It's like, let us know what services exist. The other thing that I found very interesting is the service providers and the community leaders said they're not even aware of what services exist, meaning that they don't talk to one another. They want more networking, more collaboration, and that round table that Mark mentioned, I think, is kind of the answer. That's what they were looking for, is kind of a quarterly or monthly or however often meeting where they can all get together and discuss, what they're doing, new services, kind of get to know one another, et cetera. Okay, the other big finding is the availability of services in the township. I know it wasn't news for probably most of you that there's the inventory of services show that services in Dundee Township are sparse, but even in the surrounding areas, there's services that are limited. Okay, 36.8% of survey respondents state that mental health services, 15.8% indicated IDDD services, and 10.5% reported substance use services are lacking in the township. Additionally, 15.8% said all services are lacking in the township. So this is from the survey, the residents. And when we asked about the individuals that actually have the disorder or disability, where they go for services, we had people saying they're traveling to Chicago in some cases for services. Hinsdale, they mentioned places all over the northern part of Illinois. Now, some of that might have to do with their specific condition, that they can't get a specialist unless they go to Chicago or something. But others were traveling far different distances for non-specific services or non-specialized services. Board members commented that a weakness is that residents need to travel outside of Dundee Township to get services. And like I said, the inventory shows that services in the township are sparse and even in some surrounding areas. Availability of services for children and teens. Teens came up pretty strong. Service providers and community leaders discussed the need for mental health services for children and teens, especially those from low-income families. Survey respondents report that among teens, and this was an open-ended question, like what is the biggest mental health issue among teens in the township? 14.3 reported depression, 11.8 said anxiety are the top issues. Service providers and community leaders also discuss the need for substance use services for children and teens. They mention the substance use among elementary school students, middle school students, and school-age students is high. I've been doing these type of surveys for years, and elementary school did not come up years ago. Middle school and high school was definitely an issue for, substance use was an issue, but never elementary school. So this is a changing, it's changing, lower age. 1/5, 21.7% of survey respondents indicated that among teens, substance use is the biggest issue. Again, this was an open-ended question. Service providers think there's a need for K through 12 prevention education, then especially for substance use, but also for mental health. Children can be taught coping skills so that they don't wind up with a mental health disorder, learning how to deal with certain things. So we didn't ask it in this survey, but in previous community needs assessment studies that we've done for other mental health boards, we have asked that question about, of residents, of how important they believe prevention education is. And we always find that it's 90% or more of residents believe that it's important. And so we didn't ask it just for that reason, because we always get the 90% or more, so we'd probably find it here too. And then the inventory of services shows there's few existing services for children and teens in the towns surrounding the township. So there's really a gap for children and teens for services. Another thing that came up pretty strong was the availability of community support services. According to the survey respondents, the majority, 89.3% of individuals with a mental health disorder, 48.7% of individuals with an IDDD, and 34.1% of individuals with a substance use disorder were not able to get community support services. The survey respondents indicated the following community services are needed. So these are individuals that have someone in the family with a mental health, substance use, or IDDD. They said they couldn't get these services, and that included caregiver, respite, transportation, housing, and anxiety, depression support groups. When we spoke to the community leaders and the service providers, as well as we also heard this from the survey respondents, they said there's a need, again, for respite care, transportation, housing, IDD, and transition job training, mental health support groups, parenting classes, and assistance applying for services. And the last finding is the cost of service. So we heard from the survey respondents that they have difficulty affording services. And these are individuals, again, that actually have someone in their household that has either has a mental health disorder or substance use disorder, an ID or DD. 54.4%, more than half, of individuals with a substance use or someone in the household with a substance use disorder have had difficulty affording the services. 48.4, almost a half again, of individuals with an IDDD, and 37.2% of individuals with a mental health disorder have difficulty affording services. More than 2/5, 43.6, indicate the cost of services is a barrier to accessing services. And then when we did the focus groups and spoke to the mental health board members, they report that cost is definitely a barrier, and it's across all income levels. So you always think of people below the federal poverty level, and that's what we usually talk about, are the people that can't afford to pay for services. However, this goes beyond what we heard from the service providers, community leaders, and board members. It goes beyond those individuals. And so, and I gave the poverty rates for the different areas that are highest, East Dundee, Elgin, Carpentersville. But there's something called Alice households. They are households, and this is United Way has a whole study on Alice households. They're above the federal poverty level, but they don't make enough to afford the basics. So to actually, things like food, housing, etc. In Kane County, that's about 23%. That number is, I think, about 3 years old. At this point, they haven't updated the study, but it's about 23%. So you can figure, from there about approximately how many households in the township fall into that group. So they're having trouble affording services. And then, the service providers told us that's a sliding scale. People say, well, let's provide a sliding scale. That's the solution. Well, even in some cases, that's expensive for some individuals. So we found a lot of other things. We were able to, one of the interesting things that we did in this study was to actually take the data and extrapolate the number of individuals in the household that have, let's say, a mental health disorder, and extrapolate it to the entire population. So in the survey, we found out there was 39.6% of individuals that have a mental health disorder in the township, and we extrapolated that. Your population is about close to 65,000, let's say. 13,725 individuals have a mental health disorder. Substance use was lower, 9.6%, but about 2,395 individuals have a substance use disorder. And IDDD was 26.4%, which is about 5,570 individuals. So we were able to figure that out through the survey results, and you can see the extent, especially mental health. We're talking about 40% of your population says they have a mental health. Now, this is not just a disorder, so these are not just people that have been diagnosed. We asked about symptoms as well, so that includes people that actually say that someone in the household has mental health symptoms. They might not have been diagnosed, they might not be getting services, or they might be getting services. So that was something interesting that we did in this study that we have not done before, but we'll be doing in the future. So, questions?
Substance abuse in grade schools, or how are they trying to prevent this, or what do they do? What do they do for this?
That's a good question. The schools are really struggling. I do these focus groups in other areas with with community leaders about substance use, mental health, and IDDD. And I hear from them that the schools are really struggling with the students. A lot of the students are just out of control, and it's not just substance use, it's behavioral problems, it's mental health problems, etc. And they just don't have enough staff to deal with it.
Do the parents cooperate with the schools most of the time or some of the time?
I don't know, but what we heard in the focus groups is that the parents are not good role models, that the parents are actually using substances. And so the children see that and say, well, my parents are doing it, or, it might be an aunt or uncle or some other adult that they see, and they say, well, why not? Sometimes it's alcohol, sometimes it's drugs, that drugs are very, readily available. They know, how to get them. So, yeah, it's a very serious problem.
Has there been an increase since DARE was taken out of the schools? And I know, some of the stats show that DARE wasn't that effective, but it seemed, and a lot of things have changed since when I was a kid to when my son, who's 17, was a kid.
Right.
Any insight on that?
There are some programs new programs to address substance use that we're not sure how effective. Supposedly they're effective. I mean, you have to wait and see. You can't know the effect of some of these things for years. And I think that's what, the DARE program, everybody thought, okay, it's working, it's doing a great job, et cetera. But then you wait, go 10 years down the road or longer and you see it didn't do, really what it was supposed to be doing. So those measures, what we call outcome measures, are very important, but you can't measure that right away, especially for new programs. Yeah.
I've attended budget hearings for District 300 for several years now, and each year from at least 2019 forward through and including the next budget cycle, there has been additional behavioral services, therapists, psychologists, counselors added every year. They keep adding more and more and more. They have difficulty hiring a sufficient number of personnel to meet the needs, so then they contract for services to third parties. And with all those resources that our tax dollars are going towards, it's disappointing to hear a report like you presented that we don't seem to be achieving. We're not getting anything for our invested dollars. It's a generalization, but I mean,
Sure.
It's just in the focus groups and in your survey, how did that flush out in terms of when is District 300 going to be held accountable? And the parents are another big factor. And maybe they just throw up their hands and they say, we can't get the parents to support, but can you add anything else in terms of accountability with District 300?
Make a comment on that, having my son in the school, but go ahead.
I don't have anything. I mean, we heard in the focus groups, parenting classes came out of the focus groups with the community leaders, that the parents need to be taught to be parents,
Be willing to do it. That's
Right. And they don't have enough staff, and that's in the schools, and they don't. It's difficult to hire people and pay them decent salaries, and we heard all that, but I don't think they know what the solution is. They talked about social media being a problem, that you're having the phone, students have their phone all the time and they're always looking on it, and they're not interacting in the real world, basically. I mean, they talked about all those issues, but they don't know what exactly is causing it and what the solution is.
Mr. Dennis, we did invite D300, they were present at that first stakeholders meeting a few weeks ago, and I feel there was an administrator, Sanchez can comment on this too if he'd like, but there were some interesting comments made by one of the counselors there and about what some of those gaps are and what happens when kids are referred to their office, but then what happens afterwards. So I think some of the value of this mental health board for Dundee Township is going to be connecting these groups to see how we can all help each other, right? How we can be more efficient. And because, right, there is a lot of money and resources being thrown at this essentially, but if it doesn't do any good, then it is a waste. So I think there's going to be some interesting connections, and again, if the township, that is our role, is to make sure the resources that are out there already, that people know about them. So specifically
because of COVID,
yes,
that program, District 300 alone got over $35 million, and a lot of it was devoted for all these behavioral issues.
right. Right. Mr. Sanchez, anything you wanted to add from that meeting, or just?
No, I think that's some of the high notes on this part of the conversation for sure.
I do have a question. Both of you have stated that it's doing no good. Do you have any statistics to back that up, that it's doing no good, all this?
The counselor said that, I think her stat was 90%. There's no follow-up after. It's like 90% of the kids that are getting sent to her office. Also, there's a lack of training, right? So like when teachers have their Teacher Institute Day or whatever they call it, this group of counselors has no training, right? So how can we help facilitate that? So, I mean, that is right from the counselor that's in the school. And I think I don't know if she was a Crown, I forget where she was at, but her stat was 90% of these kids are not getting connected or unable to get the resources they need, right? So they see the counselor at the school, but then where's the follow-up?
Okay, so how is that a waste?
Well, if they just see a counselor and then there's no care, then it's, why do we have the counselors?
So, okay, that's my point.
So again, I think if we can help connect that, I think that there'll be some value there
It's
for
a
sure.
service gap issue, really. So it's, the biggest thing on that topic that was a surprise was the fact that the psych department for, to generalize everybody that does that work at the school district doesn't have a professional development day where they all get together like teachers do and have work sessions and get valuable information from outside entities. And so I think what we're gonna try and do is help organize a professional development day for them where they have all the service providers that provide services in our area, come and speak to them and tell them about the programming that they have and see what they need, and then maybe programs can be designed and built that way as well to meet the need that exists there, because it's not, why are we doing this? It's just, there's not enough. We need to do more, so.
And maybe it's a
Filling in
stop
that
gap. You key in, there's such a need for services. And the reason I bring this up is, my son has been involved with shelters that start out as shelters for abused women who go. And through a series of things that go on, and this is in the state of Washington, women who meet a certain criteria of a mental health review are given a chance to go to a secondary type of shelter where they can live. And they arrive frequently terribly abused, sometimes hospitalized. Their children are beyond traumatized. The children frequently have terrible, one little boy, his father took a broken beer bottle to his face. That's the level of trauma that goes on in these shelters. So this started maybe 10 years ago or something on that order. These kids were, Charlotte, sit and be quiet, shh. All these kids were way below grade level. Their health was atrocious. They were just in bad, as were the mothers and everything like this. Today, every child that was taken in and through this program is operating at grade level or far above. There are kids going to college. There are kids who are stable. But what happened here was, first of all, they had a safe place to live. And it was a steady place to live. They were never worried about being homeless or never the pressure of, are we going to have our lights and our electricity shut off or our water shut off? These kids are in a stable, closed community. They do attend public schools and everything like this. But my point here is that a counseling session may alleviate a temporary thing and may get some kids off to a better place if they can continue it. That is not going to work for everybody else. I don't think that's money down the tubes, but I think it is so woefully inadequate until, and they are finding this in other places. In California and places that are dealing with people with these issues, they're providing them with enough money to provide shelter for themselves, even when they have substance abuse problems. And they're finding across the board that these people end up, for the most part, far better off. They function, they frequently have jobs. Even when they have substance abuse, they either have a lesser death rate or a greater rate of beating the substance abuse, and they're better to their kids. I know one of the things that we talked about when I was on the mental health board was providing parenting classes for Hispanic children, or for parents who only spoke Spanish. And this was highly controversial. I think it was dropped. But yet that is something so simple. It was a $10,000 program. And if you can nip those kinds of parenting dysfunction in the bud, at the beginning, or help them early on, you go a long ways. Because I think, Mike, you were right, and Aaron, all of us, this is a failure of parenting across the board. But the failure of parenting is by people who have never been parented themselves. We're dealing with a second or third generation of people who have been born and raised in dysfunctional homes by parents who couldn't afford to keep a roof over their head or keep the utilities on, or they were working 2 or 3 jobs and could barely afford, they could barely come home and sleep at night. So when we're dealing with this level of societal dysfunction, we can expect to spend a lot of money and a lot of effort and see a long, long return rate. But I tell you, like I said, with this group of kids, they were at the bottom of the bottom, both mentally and physically. 10 years later, every single child and every mother, those mothers are working. Several of them have 6-figure jobs. They are that talented and that able and everything. But they were given a safe place, and they were given the counseling they needed and the support they needed. And they are thriving. And those kids, many of them are going on to college. The ones that aren't are in technical schools. One of them is a girl who's an airplane mechanic. She's earning $100,000 a year at the age of 19. Can you imagine? And this was a kid who was barely functioning 10 years ago. So if we put that money in there, but we got to give it time, and we've got to give those kids more than a counseling session. And you're absolutely right. I think it's so important, the silos between the different service agencies, but that Maslow's, what is it, the pyramid of thing, the bottom is a secure place to live, enough food and safety, and then you can build on that. But until we have those things, and because we've lost so much in our society, we have to build that now, and it's going to take a lot of money and a lot of time.
Yeah, so just for the record, the program that you're referring to was not dropped. It's actually, we just got the first roster list, and funding is in progress with that, which is good. And then again, I think, the challenge, 1 out of 4 households is at Alice level. They can't afford the basics, right? Yeah. So there's a bigger picture problem here. But again, I think this board is gonna have some big decisions to make on how much is gonna go toward the preventative care so that we don't end up with people in shelters, right? Yeah. So there's a lot to look at. So we do need to move on. One last comment. Sorry.
I still have some questions.
Okay, sure.
And I've been trying to get this answer since you started, but you said that the survey that was sent out was randomized, but somebody had to give some parameters to get your list. So, you wouldn't have sent it to every 7-year-old in Dundee Township?
No, it was, we asked for a random sample of households in the township, 2,000 households in the township. And this firm basically has all the information, about the households in the United States, and addresses and emails and telephone numbers, and knows a lot about each household, all the demographics and all kinds of things. Amazing how much they know. And so they just randomly select, it's all computer generated, those 2,000 households. It's totally random. So, when I say random, it's like there's no bias. So it's not, I picked my friend Joe's household, or it's totally, there's no bias whatsoever. That's what I mean by random.
But if they didn't have an email address, they weren't selected.
No, they were selected by household. So it's done by address. I'm sorry, by address. Right. So they start with the addresses. They then match the telephone numbers and the email addresses. Now, they have email addresses probably for about 75% of those households that they randomly selected. And then we have student workers who then search. We purchased a database that you can search email addresses, so you put in the address and I can find an email address for you. So if you ordered a pizza or some Chinese food and you gave your email address, it's in that database. So we were able to get for probably 90% of the households had email addresses. But then there was the hard copy survey, so everyone got that because everyone has a mailing address.
Okay.
Yeah.
And then I did look at some of the economic metrics that you had here, and you were reporting out, I think, data from a 5-year span over 17 through 23, so that
Yes.
included COVID years. But
Yeah.
like you reported out the unemployment rates at 29% and then 25%, and they're closer to 5 and 7%. So I was a little concerned just with your. It wasn't like you were taking the latest data available, because that also has an economic impact.
Yeah, we don't use the one-year estimates that are the census or American Community Survey provides. The one-year estimates are not as accurate. I understand that was during COVID, yes. But the one-year estimates are kind of, small group. It's actually from a survey. The American Community Survey one-year estimates are from a survey. They randomly select households to complete part of the census survey. And so the accuracy, because they don't put as much money as the 10-year census into it, not as accurate. So we use the 5-year because it's more accurate. Now, yes, in this case, it was over COVID years. Yeah, a little skewed. But it's not that much off if you look at the 5-year estimates, before that, it's not that much off.
And just one other question, because a lot of the responses that came back are very subjective. You're asking people, what is your opinion, what is, but when they come up and say waiting time is too long to get seen, I don't see anywhere where their wait time is 3 days and that's too long, or is it 2 weeks and that's too long? Because there's no hard.
We didn't ask what they consider a long wait time, that's a very good point. We have heard in focus groups with residents, not in this township, but when we did focus groups with residents in other townships, that there are cases where they're waiting 3 to 4 weeks to get an appointment. This is all over that, and this is consistent in other townships that we've done focus groups in. It's just understaffed. The agencies are understaffed, and it's causing the wait times in most cases is because of the understaffing. There's just not enough staff to deal with the number of individuals that have mental health and substance use problems.
All right,
Yeah.
Thank you, appreciate it.
Thank you.
Just one quick question, because it kind of piggybacks on the Alice households, when you were talking about that, my question with that, do you think that money management might be part of the issue too, and maybe like say financial counseling classes? Because that's another thing with sometimes like the lower income where they're not sure how to handle money, and if they're brought up with that, they don't know how to manage money.
This is, it's based on the cost of the basic item. Actually, is calculated. So it's the cost of a house, average cost of a house in a county, average food, etc. is figured, and then the person's actual income, is looked at to see if it matches what is actually needed to get the basics in that county. So I don't know. It might be. Money management might help, but it's really based on what the income they're bringing in.
That's just what's reported. So if there's cash under the table, you only have what's coming in as reported. So
Right. It's what they report as their annual income. Yep.
Thank you so much, Dr. Schneiderman. As she stated, the full survey and needs assessment is on our website, dundeetownship.org. Click on Mental Health Board, and you can find all the details there. And of course, Administrator Sanchez has office hours during the week if anybody has any follow-up questions. But thank you, Dr. Schneiderman, for being here with us tonight. We appreciate it so much. very helpful.